So you're thinking about getting permanent sterilization, getting your tubes tied, or getting your tubes removed. Um, Great approach if you're done having kids. Um, Very safe, very effective. We do want you to be sure you're done having kids though. Um, and if you're watching this video, then I'm sure you're pretty confident of it. But I will tell you that they've done studies, 10-year studies, many studies on women after getting their permanent sterilization, and have discovered from 30 to 70% of women, so let's say up to 50% of women, regret their decision. And there are risk factors for this. So regret it, saying perhaps they're still interested in having more kids. So some of the risk factors are being in your 20s, only having one or no kids, only having one sex and wishing you had another, so only having a boy and wanting a girl, being single, unmarried, and well, those are the risk factors. So we encourage you to speak with your physician about the risks and benefits and also the alternatives. I'm a big fan of very effective methods of birth control that are not permanent, especially the progesterone-containing IUD. So there's the Mirena, there's the Liletta, there's the Kyleena, there are others. Those are the main ones. There are larger ones and smaller ones. The two of them last 7 years. They're equal to slightly better at preventing pregnancy, but allow you to change your mind. More on that in another video, but if you're still convinced to have permanent sterilization, there are many variations. There is a Tubal Ligation, which is tying the tube. So if my arm were your tube, that would be interrupting this part of the tube and tying those two ends together. Should you change their mind, then you can later have a surgery to put them back together. That's called a tubal reanastomosis. Doesn't always work, and it's pretty expensive, well over $10,000 or in that ballpark, and insurances generally don't cover it. Whether you have your tubes or not, you have the option of in vitro fertilization, test tube baby, which costs about $10,000 a try and has a higher risk of multiples like twins or triplets. Okay, so recently, in the last few years, we've begun recommending salpingectomy, which is removing the tubes, the whole tubes. We've discovered that half of all ovarian cancers are actually tube cancers. And so in theory, we should be reducing your risk of quote unquote ovarian cancer by 50%. We've only been doing it for a few years, so it's only a projection into the future, but it's certainly become the treatment of choice of type of tubal ligation. There are others, a clip to put, burning them instead of tying them. They all have the same effect, those interrupting the tube but leaving some intact to be restored. Your tubes can be tied at the time of a C-section. They can be removed at the time of a C-section. They can be tied or removed a day or two later, or 6 weeks later, which would be done laparoscopically. Those are individual differences that you're best discussing with your physician, maybe their personal preference. There are some pluses and minuses to each of those methods. Another alternative is always getting tubes tied for the man, the vasectomy. I'm not an expert of that, never performed that surgery. They are very effective as well. All of these treatments I'm mentioning are in the same ballpark of effectiveness at preventing pregnancy. None of them are 100%. There's lots of information about a vasectomy being simpler, less expensive, not requiring an operating room, can be done in the office. I know of many patients of mine whose husbands or partners have had a vasectomy and done great. I've also had 3 patients come to me without being asked. They just mentioned to me, hey, I just wanted you to know, and please relay this to your patients, that my husband had a vasectomy and he now has pain with sex, with intercourse. Very rare event, but certainly not one that was welcome to either of them. There is no procedure that doesn't have any risks, and I did follow up on those patients, and 2 of them, it went away in a couple of years, and 1 of them, it hasn't gone away, and it's been many years. So none of these procedures have zero risk. Let's get into some of the risks of getting your tubes tied. All surgeries have a risk of bleeding, infection, anesthesia, injury to adjacent organs, and chance of failure, meaning getting pregnant. So the risk of tying the tubes is very, very low. In fact, some studies suggest getting your tubes tied is less risky than the risk to you of having a baby. So you certainly bleed substantially less. If you do have enough bleeding from the surgery or from your delivery, you might need a blood transfusion. Those risks are very small. Risk of hepatitis, of HIV, very, very low risk. Those numbers evolve with time, so I won't quote a specific risk, but they are certainly low. A risk of infection, that's a little higher risk, but for any surgery, sometimes we give preventative antibiotics if you're specifically at high risk, but generally for the small incision, the laparoscopy, we don't even give preventative antibiotics because that risk is so small. A risk of injury to adjacent organs means when you put sharp instruments near the human body, there's a chance someone will get cut or injured. That wasn't meant to. That means doctors are human, errors occur. Things that can get injured are bowel, bladder, blood vessels. Again, very rare and something that you should discuss with your physician who'd be performing your surgery. Overall, I think the most important take-home message that I can give you is to be certain that you want no more children. And if you have any hesitance, then permanent sterilization for you or your partner is not a wise choice, because there are great options that are virtually as effective at preventing pregnancy. I hope that you found this helpful. Thank you.